Minnesota AIDS Project was founded in 1983 by a group of very concerned gay men who came together locally to address what was then really an unknown epidemic. Funding came together from a number of local foundations and ultimately through the government to provide prevention services as well as services for those living with HIV. And it was during that period of time, the late 1980s, early 1990s, through the mid-90s, where MAP grew very rapidly to fill this need. Simply put, the mission of the Minnesota AIDS Project is to stop HIV. It's a lofty mission, but the way in which we work is through primarily three areas of programming: advocacy, education, and services. Our advocacy program works to create fair policies and remove barriers for those at risk or living with HIV. We do that through lobbying work at a local and a federal level, through grassroots organizing, and getting average citizenry engaged in the process that sets policies and directions for those living in at risk of HIV. On the education front, we provide both general information and education for the broader community. There still remains so many questions about what causes HIV, how can I protect myself, should I get tested, how do I talk to my kids, how do I talk to my sexual partners about risk. And we provide those services both web-based and as well as through a telephone program, the Minnesota AIDS Line. We also provide that education and prevention services in a very targeted manner for those who have been identified by the state at highest risk for HIV. And that includes gay and bisexual men, as well as injecting drug users. So we have a series of programs that work within the gay men's community, and we have a street outreach program targeting injecting drug users and their sexual partners. We have a very active website with web-enabled chat. People can email in questions or actually talk online, or even call someone on the phone and have those questions that you've always wanted to have answered. And the AIDS Line can provide referrals and information to all of the great AIDS organizations that are part of the Red Ribbon Ride, as well as AIDS organizations and other social service and health groups across the state. And then finally, on the services side, we have a full range of supporting services for those living with HIV, from case management to medical transportation services, to emergency financial assistance, to legal advice, benefits counseling, and a transitional housing program. So we pretty much will provide assistance for individuals from the time that they recognize that they may have a risk and have questions, all the way through and including the experience of living with, and for some dying from HIV.